Before we begin, please know that some episodes include language that may be sensitive for some people. Thank you for joining me for another episode of The Birth Portal. My name is Connie. Today's true story began with a woman named Jody, who was having her first baby. Her labor was a slow one, unfortunately. She had been up all night, and the contractions were only 10 to 15 minutes apart. Jody paged and was crying, exhausted, and worried how was she going to make it through active labor when it kicked in. Jody had tried Tylenol and Gravol, but that wasn't helping her. "Please help me," she pleaded. "Jody, let's meet at the hospital, and we'll see where you're at, and then we'll give you your options of what we can do. Perhaps a small dose of morphine will let you get some rest until your body is ready for labor. 10 milligrams of morphine can be given as an injection into the buttocks. It often can be just what is needed to allow the woman to rest for a few hours, and they often will move into active labor after that period of rest." Jody met me at the hospital around 10 a.m., and her cervix was almost 100% effaced or thin. It had gone from being 3 centimeters thick down to a half a centimeter thick, and she was 2 centimeters dilated. Her cervix was really soft and stretchy, a good sign her body was close to moving into active labor. I encouraged her after an hour of monitoring the baby following the morphine injection to go home, eat a good meal, drink lots of water so she doesn't become dehydrated, and try to get some rest. The body is like running a marathon when in labor. It's a major workout, and it's incredible how many calories are burned with minimal movement. And contractions that cause heavy breathing cause fluid loss with every exhale. That's why some women need IV fluids in labor. Thankfully, Jody was able to get some rest for about 5 hours. She paged me back around 5:30 p.m. to report contractions were every 3 to 4 minutes now with bloody show. But her membranes hadn't ruptured. I reminded Jody that it was normal for her membranes to be intact. We planned to meet at the hospital in about 30 minutes. And I say, don't forget to bring your pillow and your phone to take photos. The hospital pillows are terrible. They're covered in plastic, so they don't breathe very well. I called the hospital labor and delivery unit to inform them I'm bringing the same client in from this morning, who now sounds active. I get to the hospital and pass 2 colleagues of mine in the hall who had just finished up from a birth. They wish me well and head home to their families. When Jody arrives, she doesn't look exhausted, rather more hopeful. Her partner Julie smiles and says, "I have her pillow," with a big camera hanging around her neck and pulling a suitcase. "Perfect, let's get this party started," I say, as Jody's in the middle of a contraction that demonstrates progress has been made. She can't do anything but focus on getting through this contraction. Jody has progressed well, and her cervix is now 5 centimeters dilated and paper thin. I feel a big bag of water bulging with the contractions. "We can now admit you, Jody. Would you like to labor in a tub of warm water?" "Oh my God, yes, please, that sounds amazing." Jody had expressed that she was hoping to have an unmedicated birth and was hoping to labor in water. Before long, she steps into the big tub of water, enjoying a red popsicle, smiling, saying, "Oh, this is so much better." And Julie is playing her playlist with the pretend candles around the room. Jody stayed in the tub for several hours, getting in and out to pee, but getting right back in. After 4 popsicles and going through her playlist 3 times, she feels a popping sensation and says, "I think my water just broke." Nothing is visible in the water, and the baby's heart sounds great. There is then a pause in Julie's contractions. When this happens, our spidey senses go off. Membranes that spontaneously rupture and then pause in contractions when labor was well established with a good pattern of contraction often means full dilation. The body's taking a short break before beginning to push. 5 minutes later, Jody starts a contraction, and we heard the unmistakable primal grunting. "Jody, this is what you've been waiting for. Trust your body. Let it do what it wants." I check her cervix in the tub, and she is in fact fully dilated, but the head is still a bit high. I encourage her to stay in the tub while I go set up the birth instruments in the room across the hall. The charge nurse is updated. My backup midwife is called to come, who's about 45 minutes away. Jody and Julie walk into the room just as I finish setting up. She's wrapped in a blanket, shaking and worried. Everything is unfolding normally, Jody. Why don't you go pee one more time? She is successful, and Julie says she had a huge pee. Great, I'm thinking in my head. That should help the head come down nicely. Jody, you can get in whatever position you want. Listen to what your body guides you to do. She chooses to lie on the bed with the head up a little bit. It's a bit early, but would you like a mirror to see when the baby's coming? She says, yeah, sure, I think so. After about 30 minutes, I check to feel where the baby's head is at. It's come down, but minimally. Let's try another position, Jody. Movement every 20 minutes or so is a good idea to see if that helps with the descent of the baby. She moves onto her hands and knees, and we cover her with a sheet. Her contractions continue to come every 3 minutes. She's pushing well, but the baby is moving down slowly. Jody tries standing at the bedside, with Julie on the other side, their hands locked. Jody moving into somewhat of a squat during a contraction. We have a soaker pad on the floor for her to stand on. How about another popsicle for some energy, I suggest. Can I have one too, asks Julie. What color would you two like? Jody says blue, and Julie wants a green one. In my head, I'm thinking, green and blue lips for photos are not my pick, but I think there's time for the color to subside. They barely get the popsicles halfway done when Jody gives a good push, and the tip of the baby's head is seen while pushing at the bedside. Okay, Jody, you will deliver the head soon. You can stay in that position, or you can lie on the bed if you want. I can't move. She's gripped with another contraction. Easy, easy pushes, Jody. Say house, house, house. If a woman says words like house over and over, it stops with direct pushing. Good job. Just like that. You're so good at this. Jody continues to say house throughout the contraction as the baby's head descends. It burns, she says. Your body is open like it has never done before. Trust your body. Say, I can do this. I can do this. She repeats, followed by some colorful cuss words. Reach down and touch your baby's head. No! It's okay. Breathe like me, Jody, and I guide her. The baby's head will be born with the next contraction. You are amazing. I can't do it. Julie looks into her eyes and says, Baby, I'm so proud of you. You are incredible. You can do it. I'm here. Come on, one more time. Well, Julie was right. The baby's head and body came easily with the next contraction. We lowered the bed and had Jody lie on the bed and put her son to her chest, bright-eyed, quiet, and pink. Is he okay? He's not crying. Yes, he's fine. He's pink, he's alert, and breathing just fine. They rub him and kiss him and shower him with affection. A long haul with a perfect outcome, arriving 20 minutes into the 29th of February, the first of 4 babies for me this day. Jody and baby are on the postpartum floor 2 hours later. I'm heading home. As soon as my head hits the pillow, I get a page from the hospital. I have a client who had been admitted in the hospital was now having an emergency cesarean section for heavy bleeding due to placenta previa. That's where the placenta implants over the cervix. Those babies must be born by cesarean section. The placenta provides oxygen and nutrients and therefore can't come before the baby is born. The baby is delivered quickly, 12 minutes before I even get there. Mom had to be put to sleep under a general anesthetic due to the urgency of the situation, and Dad is on his way in. Some women with placenta previa deliver prematurely, but this baby is right on time, 37 weeks gestational age, so a term baby, thankfully. The baby is doing very well, so she will be under the care of midwifery, and I get to hand the baby to Dad soon after birth, with Grandma following close behind with her camera. The happiness and concern at the same time in his eyes, happy to receive his daughter. He says, How's my wife? Looking tortured, waiting for the response. She's doing well so far. Does she still have her uterus? Yes, they're sewing her up as we speak. I had a first-year midwifery student with me who suddenly turned white and had to excuse herself. I look at Dad. She'll get used to it, I say. We all do eventually. Looks like baby number 3 is wanting this special birthday of February 29th. Jada is expecting her 3rd baby. We call 3rd babies wild cards because we can't predict their labors, unlike the 2nd baby's labors often being half the length of their siblings. Jada is 2 days past her due date when she arrives to the hospital, saying she got lost twice on the way in, and she thinks her water broke. Some women can't say with certainty, while others get the Hollywood gush often portrayed on TV. I check her cervix and she's a good 7 centimeters dilated. I need an epidural, please, she says. Okay, Jada, I'll do my best, but it will take some time to get your admitting blood work and you could potentially be ready to push very soon as this is not your first baby. Within 20 minutes, Jada starts saying, I can't do this, I can't do this, hands reaching into the air like she's trying to escape her body. Those are the famous 4 words midwives like to hear, and puts grins on her face, usually an indication a woman is close to fully dilated. Jada wants to lie down suddenly and moves to her side, grabs her leg, and pushes like she's done before. My student has recovered and is there with me to quickly catch this baby girl born easily and without any concerns. 2 hours later, the charge nurse comes to the room and pulls me aside. One of your colleagues is on her way in and we need this room as soon as possible. We quickly get Jada and the baby to the postpartum floor, just in time for the next woman who arrives with rectal pressure on admission. I stayed as the backup midwife for that delivery, which happens within minutes of admission, and thankfully, without concern. It's 2:30 p.m. I'm wide awake. I should be comatose at this point. By 4:30, I'm fading, smiling inside, thankful for such an amazing career. At 7:30 p.m., my pager goes off again. A client is bleeding and needs an assessment. I can do this. I can do this. More coffee. Thankfully, all was well. Bleeding was within normal limits, and we were all in bed by midnight. Oh, my pillow never felt so good. Thank you for joining me for another episode of The Birth Portal.